Good afternoon, everyone. Welcome to the Health and Social Services Subcommittee Budget Decisions meeting. We are going to turn the floor to our DLS analyst to walk us through the packet and take votes on each of the decisions.
Good afternoon.
Good afternoon.
Page one.
Sorry, 1 second. Before we start, I just wanted to let you know you have two packets before you, the main document and the and some blue additional pages, and the analysts will be going through the document in order, but we'll refer you to the page, the blue package as appropriate.
Thank you, Ms. Zimmerman.
So in the white packet, on the first page, DLS recommends to increase turnover expectancy for 2 new positions from 0 to 25%. That involves a decrease of $39,000 in general funds. The agency disagreed and Senate rejected.
Move to concur with the Senate to reject the DLS recommendation.
Second.
Do we vote then? All in favor, say aye.
The second recommendation is to adopt committee narrative requesting that the Office of the Deaf and Hard of Hearing submit a report on the boards of sign language interpreters formation and operation. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
On page 3, for the Department of Disabilities, DLS recommended to adopt committee narrative requesting that the Department of Disabilities submit a report providing an analysis of the Universal Services Trust Fund expenditures. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
On page 4, the first house requested a report on the efforts to fill the vacant positions, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
On pages 5 and 6, under the Department of Aging, DLS recommended adopting 2 pieces of committee narrative requesting 2 reports. The agency concurred and the Senate adopted on both.
Move to concur with the Senate.
Second.
All in favor?
On page 7, the Senate adopted additional committee narrative requesting a report on Prince George's County Local Area Agency on Aging Operations and Spending.
And the Senate adopted?
The Senate adopted.
Okay. Oh, right. This is first house action. Concur with the Senate? All in favor?
On page 8, for the Maryland Commission on Civil Rights, DLS recommends adopting committee narrative requesting Maryland Commission on Civil Rights to incorporate data on the backlog and open cases in its annual Managing for Results submission. The agency didn't provide a response and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
On pages 9 and 10, under the Maryland Institute for Emergency Medical Services Systems, DLS recommended concurring with the governor's allowance. The Senate adopted additional committee narrative requesting an update on long-term vacancies.
Move to concur with the Senate.
Second.
All in favor?
On page 11, for the Maryland Health Benefit Exchange, the first recommendation is to adopt narrative requesting a report on the reinsurance program cost and forecast. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor? Thank you.
On pages 12 through 14, DLS recommended restricting funding, adding budget bill language, restricting funding pending submission of a report on staffing and salaries. The agency disagreed. The Senate recommended a modification to request fewer pieces of information with the report.
Move to concur with the Senate modification.
Second.
All in favor?
On pages 14 through 16, DLS recommended adopting committee narrative requesting a report on overdose response efforts at the department. The agency disagreed, and the Senate provided a modification to ask that this report this information be included in the annual report of the Commission on Behavioral Health Care Treatment and Access. In addition, there is a piece of narrative for your consideration on page 1 of the blue packet, further modifying this recommendation.
Okay. Move to further modify the Senate narrative as reflected on page 1 of the color pages.
Second.
All in favor?
Turning to page 17 and 18, this reflects an additional action taken by the Senate to adopt committee narrative requesting a report on the implementation of recommendations from the financial compliance audit.
Move to concur with the Senate.
Second.
All in favor?
Aye.
For the Office of Healthcare Quality on page 19, the recommendation was to concur with the governor's allowance. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On the next page, on page 20, for the health professional boards and commissions, the first action is to add language restricting funds from 3 health boards pending a report on efforts to meet their complaint investigation goal. The agency did not provide a response, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
The second action on page 21, still for the health professional boards and commissions, the recommendation was to strike language that allows the Board of Nursing to receive reimbursable funds for infrastructure operations, since this function was transferred to the Office of the Secretary. The agency disagrees and prefers to budget infrastructure operations as reimbursable funds, since these are existing and ongoing items.
Move to concur with the Senate to reject the DLS recommendation.
Second.
All in favor?
Aye.
Thank you.
On page 22, there's an additional first house action to adopt narrative requesting a report on the transfer of Board of Nursing infrastructure operations. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On pages 23 through 26, DLS recommended restricting funding pending a report on the local health department funding formula. The Senate modified this recommendation to ask that the report include information on the local match requirements.
Move to concur with the Senate modification.
Second.
All in favor?
Aye.
Thank you.
On pages 27 and 28, the Senate also adopted additional language restricting funding, requesting the submission of a report on oversight of the physician dispensing process for non-controlled dangerous substances.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 29 for the Prevention and Health Promotion Administration, items 1 and 2 are related. They both, the DLS recommendation is to reduce funding for the Center for Firearm Violence Prevention and Intervention by $8 million, leaving $2 million for the program. The agency disagreed with that, and the Senate modified that reduction to reduce $6 million, leaving $4 million for the program.
Move to reject the Senate modification and adopt the DLS recommendation.
Second.
All in favor?
Aye.
Thank you.
Item 3 on page 30, DLS recommends reducing funds for the Maryland Prenatal and Infant Care Grant Program by $1 million. MDH disagreed. The Senate rejected.
Move to concur with the Senate to reject the DLS recommendation.
Second.
All in favor?
Aye.
Thank you.
Item 4 at the bottom of page 30, DLS recommends adopting narrative that would request that information on the public health effects of adult use cannabis be included in the annual Managing for Results data submission. The agency disagreed and said that it would take at least a year to get baseline data. So the Senate modified this action to instead adopt the committee narrative shown on page 31 to instead ask for a report due November about this data.
Move to concur with the Senate modification.
Second.
All in favor?
Aye.
Thank you.
On page 32, this begins additional actions the Senate adopted. So the first is narrative that requests reports on efforts to fill long-term vacant positions.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Item 2 at the bottom of page 32 and continuing on to page 33 is language the Senate added that restricts funds pending a report on the Maryland Prenatal and Infant Care Grant Program.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Item 3 at the bottom of page 33, and continuing on to the next page, the Senate added language restricting funds pending a report on the Maryland Pediatric Cancer Fund. If you turn to the blue packet on page 2, there is a modification of this language for your consideration that would strike 2 of the information requests based on a bill that's passed that would change how that program is, the timing of the grants in that program.
Move to modify the Senate language for the color page reference.
Second.
All in favor?
Aye.
Thank you.
And then on the bottom of page 34 and continuing on to the next page, the Senate adopted narrative that requests a report on the VIP Kids program.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On pages 36 through 39, under the Behavioral Health Administration, DLS recommended restricting funding pending the submission of a report on recoupment and forgiveness of overpayments to providers related to the ASO issue. The Senate modified this recommendation and adopted instead a restriction of $125,000 in lieu of $500,000.
Move to modify the Senate restriction to $250,000.
Second.
All in favor?
Aye.
Thank you.
Starting on page 39, DLS recommended restricting funding pending the submission of a report on reimbursements to non-Medicaid providers. The agency disagreed. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Beginning on page 41 through 43, recommendations 4 through 8 authorize the transfer of funding between behavioral health care programs and one program under Medicaid to cover shortfalls in that program.
Move to concur with the Senate on items 4 through 7.
Second.
All in favor? Did you say 7 or 8 on yours?
4 through 8.
Oh, I apologize. Well, now we'll do another. Move to concur with the Senate on item number 8 as well.
Second.
All in favor?
Aye.
Thank you.
Moving back to page 40, I accidentally skipped one. DLS recommends amending contingent language related to funding for the assisted outpatient treatment program in order to allow the intended use of those funds. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Aye. Anyone else in the room? Anyone opposed? You said aye? Okay, great. Thank you.
On page 44, there's one additional item proposed by the Senate, adopted by the Senate, to adopt committee narrative requesting an update on long-term vacancies.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Aye. Thank you.
On page 45 for the Developmental Disabilities Administration, the first DLS recommendation is to add language restricting funds in the Community Services Program for that purpose only. The agency did not provide a response and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
The second DLS recommendation, also on page 45, is to add language restricting funds pending a report on year-to-date spending in LTSS. The agency concurs with the submission of the report, but requests that no funds be restricted, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 46, the third DLS recommendation is to add language restricting funds pending a report on advance payments to providers during their transition to LTSS. The agency concurred with the submission of the report, but requests that no funds be restricted, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
There's also an additional page on page 3 of the blue packet. This item is committee narrative requesting a report on self-directed services and IFDGS spending.
Move to adopt. Right? Move to adopt is the correct? Okay, move to adopt this extra page.
Second.
All in favor?
Aye.
Aye. Thank you.
All right, on page 48 of the decision document, this begins the items related to Medicaid. This first item, DLS is recommending language restricting funds pending a report on repeat audit findings. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Item 2 on the next page, DLS is recommending annual language that restricts funding for the Medicaid program to that purpose, but it also allows transfer over to the Maryland Children's Health Program. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Item 3 is DLS is recommending narrative that requests reports on community first choice program spending and the community options registry, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
At the bottom of page 50, there is DLS is recommending committee narrative requesting quarterly reports on Medicaid enrollment change following the unwinding period, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
So then going to page 52, item 5, DLS recommends reducing funds that were double budgeted and for health insurance costs, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Item 6 on page 52, DLS is recommending annual language that restricts funding for the Maryland Children's Health Program to that purpose, but also allows transfer over to Medicaid, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Page 53 begins items that were added by the Senate. So this first item is narrative requesting a report on the recruitment and retention of anesthesiologists in Maryland. If you turn to the blue packet on page 5, there is a slight modification for your consideration on this narrative. That it's the 5th bullet adds an information request on pediatric anesthesiology versus services for adults.
Thank you. Move to modify the Senate narrative per the page in our extra packet.
Second.
All in favor?
Aye.
Thank you.
On page, so then back to the decision document, page 54, the Senate adopted committee narrative requesting reports on reimbursement for maternal and fetal medicine.
Move to concur with the Senate.
Second.
All in favor? Aye. Thank you.
At the bottom of page 55, the Senate adopted narrative requesting a report on nursing home participation in Medicaid and information on the for-profit and not-for-profit status of the nursing homes.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 56, the Senate adopted committee narrative requesting reports on Medicaid long-term care data reporting related to a federal regulation.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 57, the Senate adopted narrative requesting a report on school-based behavioral health services and the Medicaid reimbursement of those services.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 58, the Senate adopted narrative requesting a report on End the Wait initiatives related to Medicaid home and community-based service waiver programs and increasing provider capacity.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
So then page 60 begins items related to the health regulatory commissions. The first item, DLS is recommending narrative requesting an evaluation of the Maryland Primary Care Program. The agency disagreed as MDH is already conducting an independent evaluation. So the Senate modified this narrative to instead ask the agency to send that evaluation in addition to some other information that's typically requested around the Maryland Primary Care Program.
Move to concur with the Senate mod.
Second.
All in favor?
Aye.
Thank you.
On page 61 at the bottom, DLS recommended narrative requesting reports or a report on the Consortium on Coordinated Community Supports Grants. The agency concurred, the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Then on page 63, this begins items that were added by the Senate. This first item is narrative requesting a report from the Maryland Healthcare Commission on private payer coverage of ambulatory surgical centers. If you turn to the blue packet on page 7, there is a modification to this narrative for your review that would instead ask for 2 reports, an interim report in December and a final report in June of next year, and changes the information request slightly.
Move to modify the Senate narrative for the additional page presented.
Second.
All in favor?
Aye.
Thank you.
And then back to the decision document on page 63. The Senate added language restricting funds pending a report on the HSCRC's and MHCC's implementation of recommendations around trauma center funding.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
And then moving to page 65, the Senate added language expressing the General Assembly's intent that the HSCRC and MIMS continue meeting with a work group on hospital and emergency department throughput.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
And then on page 66, the Senate added language expressing the General Assembly's intent that the Community Health Resources Commission procure a closed-loop referral and data reporting platform.
Move to reject the Senate language.
Second.
All in favor?
Aye.
Thank you.
All right, thank you.
On page 68, for DHS administration, DLS recommends adopt committee narrative requesting that DHS submit a report providing information on MD Things implementation status, and the agency concurred and Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 69, the first house requested a report on Department of Human Services Administration effort to fill vacant positions. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Before we start with the next page, I just wanted to mention something I neglected to mention at the beginning, which was in some of the analysis, DLS made recommendations related to the BRFA, which don't appear in this document and will be addressed in the full committee actions.
Thank you.
Turning back to the document on page 70, this begins the actions related to the Social Services Administration. Recommendation 1 was to restrict funds pending the resolution of audit findings, the repeat audit findings. The agency disagreed. The Senate adopted.
Move to concur with the Senate. All in favor?
Aye.
Thank you.
Recommendation 2 that begins on page 71 and continues to the top of page 73 would restrict funds pending a report on caseload information related to the Child Welfare League of America caseload standards. The agency disagreed. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Beginning on page 73 and continuing to the top of the next page, DLS recommended narrative requesting a report on hospital stays by youth and out-of-home placement. The agency concurred and the Senate adopted, but in the blue package for your consideration on page 8 would modify that slightly with the kind of line below the bullets, which would request some data be broken out by region or, where possible, by jurisdiction.
Thank you. Move to modify the narrative per the language recommended on page 8 of the additional pages.
Second.
All in favor?
Aye.
Thank you.
On page 74 and continuing to the top of page 75, the fourth recommendation is committee narrative requesting a report on the implementation of the Family First Prevention Services Act. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 75, recommendation 5 is annual language that is recommended to restrict the funds in the foster care maintenance payments program. To that purpose, the agency disagreed. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Beginning on the bottom of page 6 and continuing, or 75, sorry, recommendation 6, is a recommendation that would have restricted all of the funding that was in the budget for rate reform and provider rate increase until the agency submitted information
on how they were going to use those funds. The agency disagreed, and the Senate modified beginning with that's shown on page 77. The report request is the same. The difference is that they modified the amount restricted to $250,000.
Thank you. Move to restrict to $1 million. All in favor?
Aye.
Thank you.
On page 78, recommendation 7 is annual language that restricts the funds in the Child Welfare Services Program to that purpose or transferred to the Foster Care Maintenance Payments Program. The agency disagreed. The Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Recommendation 8 was to reduce the general fund deficiency appropriation for foster care maintenance payments program based on anticipated need by $7 million. The agency disagreed, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 79, for DHS Child Support Administration, DLS recommends adopting language, reducing a total of $10.7 million in general funds and in federal funds in the Child Support Estate Program, and authorizes these reduced funds to be replaced by the Child Support Reinvestment Funds. The agency disagreed, and Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
The second recommendation is to adopt committee narrative requesting child support performance reports. The agency concurred, and Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
On page 81, the first House recommended to adopt committee narrative requesting a report on Department of Human Services Child Support Administration efforts to fill vacant positions, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Beginning on page 82, these are the actions related to the Family Investment Administration. Recommendation 1 was a recommendation to restrict funding for the Assistance Payments Program to that purpose, except to allow for transfers to the Foster Care Maintenance Payments Program and Child Welfare Services Program to replace TANF funding, and to the program Local Family Investment Program for the purpose of transferring administrative spending for the summer EBT program. The agency concurred. The Senate modified that, shown on page 83, only to change the program that the summer EBT program could be transferred to the director's office.
Move to concur with the Senate modification.
Second.
All in favor?
Aye.
Thank you.
Recommendations 2 and 5 are related, so I'll talk about them together. These were recommendations to transfer funds that are the administrative funds for the summer EBT program to the Local Family Investment Program, which is an administrative program compared to the Assistance Payments Program. The agency disagreed. The Senate modified to transfer the funds to the director's office. On page 9 of the blue pages, there's a page for your consideration that would instead transfer $5.8 million of each the general funds and federal fund appropriation for the summer EBT administrative expenses to the director's office and reduce the additional, the remaining $6.4 million.
Thank you. Move to modify the amount restricted to $5.8 million.
And,
Oh, sorry.
and also
to adopt the language on page 9 of the blue pages. All in favor?
Aye.
Thank you.
The action recommendation on page 85, recommendation 3, is to reduce $7.5 million for the EBT replacement of the EBT benefits for cash replacement due to lower estimated spending. The agency disagreed, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Recommendation 4 was to reduce special funds representing the local match for the summer SNAP program, which was not funded. The agency disagreed, and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Recommendation 5 was already addressed, so if you turn to page 87, recommendation 6 reduces the federal funds for the SNAP program based on lower estimated average benefits by $200 million. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Recommendation 8 or 7 on page 88 and continuing on to page 89 is committee narrative requesting a report on application processing times, denial rates, and case closures. The agency concurred and the Senate adopted.
Move to concur with the Senate.
Second.
All in favor?
Aye.
Thank you.
Recommendation 8 on page 89 and continuing on to the next page was committee narrative requesting a report on the implementation of the summer EBT program. The agency concurred. The Senate modified it to add a request for information related to the timing of benefit distribution.
Move to concur with the Senate modification.
Second.
All in favor?
Aye.
Thank you.
If you turn to page 92, this was an additional action taken by the Senate, which restricts or specifies the use of $950,000 that's in the budget for a two-generation model grant to just kind of specify how it would be used, and also to request a report. And the Senate adopted that.
Move to concur with the Senate. All in favor?
Aye.
Thank you.
On page 93, this is begins the actions related to the Office of Home Energy Programs. Recommendation 1 is committee narrative requesting reports on the energy assistance application processing time and denial rates. The agency concurred and the first house adopted.
Move to concur with the Senate. All in favor? Aye. Thank you. Whoops.
Recommendation 2 on page 94 is a recommendation to request information related to changes in eligibility for the energy assistance program. The agency concurred in part. They requested a change in the due date. The Senate modified to not change the due date, but change the date that the data was requested through and keep the original due date.
Move to concur with the Senate modification.
Second.
All in favor?
Aye.
Thank you.
Recommendation 3 that begins on page 95 is committee narrative requesting a report on the establishment of a centralized administrative model for energy assistance programs. The agency concurred and the Senate adopted.
Move to concur with the Senate. All in favor?
Aye.
Thank you.
And on page 97, there was one additional action taken by the Senate, which is committee narrative requesting a report on customer service in the energy assistance program.
Move to concur with the Senate. All in favor?
Aye.
Thank you.
On page 99 for the Department of Housing and Community Development, DLS recommended reducing funds for operating assistance grants that are double budgeted. The agency concurred and the Senate adopted.
Move to concur with the Senate. All in favor?
Aye.
Thank
On the
you.
back page of your document, page 100, the Senate also adopted additional narrative for DHCD, requesting a report on the designation of just communities.
Move to concur with the Senate. All in favor?
Aye.
Thank you.
That's it.
And that's all we
it.
have.
Great. That concludes our decisions meeting. Thank you, sir. I'm sorry. One moment, please. What do I move to adopt the whole enchilada, the whole thing. Thank you.
Second.
All in favor?
Aye.
Thank you. Any opposed? Okay, ayes have it. Also, just want to announce that all BRFA items will be handled in full committee tomorrow. Thank you, colleagues. We will see each other on the floor at 3 p.m. Thank you. Unless you're in Capitol, at which point I'll see you in Capitol first. Thank you.